Today, we're going to be producing just a discussion about basic labs and lab results, blood tests generally. Just as an overview, what we want to review is what does the normal range mean and what do you do with the result? So any lab test that we do has to be compared to some sort of normal range. So the lab test is reported, the result is some sort of number, and then the next question is, well, what does that mean? And so the way that we develop normal ranges varies quite a bit depending upon the lab test, and it varies depending upon how long we have had experience doing this lab test. So one of the things that is a routine method is simply to look at a normal population and then to measure the lab result in that population and then look at the average right in the middle, called the mean average, and then to put standard deviations around that mean average. So looking at that, normally we would start with about 2 standard deviations around the mean average. Now, statistically, a standard deviation is a specific percentage, and 2 standard deviations means that you encompass 95% of the population. What that means is that 2.5% of the population that is normal has a level that's higher than that range, and 2.5% of the population that's normal has a level that's lower than that range. So you can be in the normal population and outside the normal range as determined by the standard deviation. And then the same is true for people that actually have some sort of disease that this test produces, so that you could have somebody that actually is inside that 2 standard deviation normal range, and yet they are actually somebody that has the disease. So it looks like a negative test, that is, a test that says no disease here, but in fact the disease is present. So all laboratory tests, all of them, have false positive test results and false negative test results. And a positive test result means indicating that the disease is present, and a negative test result means indicating that the disease is absent. People use the terms false positive, false negative sometimes with emotional baggage, and that means that, well, this is a bad test. That's not what false positive and false negative mean. This simply means that in statistics, there's always going to be some lack of precision that we have to simply live with. And so we just have to realize that these normal ranges, most of which are that 2 standard deviation range, do not necessarily mean that everybody is identified properly once they're in or out of that range. And then the next thing to consider is that that's just a statistical evaluation, and that may or may not fit with what the disease is. So over time, we may look at a population, determine the 2 standard deviation normal range, set the normal range of the test, and then over a period of years or decades, learn that many of the people that are in the normal population aren't actually normal. And so that means we have included people with disease in the calculation of figuring out what the normal range is. Well, if that number is fairly big, lots of people that maybe have the disease, then what you've done is you've simply estimated the wrong normal range, because you've included abnormal data in the normal calculation. So over time, in many cases, we begin to learn these kinds of things so that if we were wanting to keep up on this, we would adjust the normal ranges. And that's done by various different labs at different times. But in many cases, it lags way behind our knowledge of what really is the right normal range, or what does this range really suggest? Does it identify the disease or not? And particularly in endocrinology, a lot of normal ranges are really quite incorrect, often dramatically incorrect. And so then you can have people that have normal test results, and yet they clearly have the disease that the test is supposed to identify, but they have a negative test result. So one of the things that I am kind of fond of saying is that in endocrinology, at least, normal is just a drier setting. What I'm really interested in is, does the person have symptoms that are consistent with the disease, which means that I have to listen to them and talk to them to find out what their symptoms are? And what's the lab test? And is the lab test result, yes, in the normal range, but is it in the optimal range, which is often narrower and a little different than the normal range, sometimes quite a bit different. And then there's the discussion of people that have different opinions about what the optimal range is, because we simply have insufficient scientific knowledge so far to be able to determine what is the optimal range. So you have various different experts that will say, well, this is the optimal range, or that's the optimal range. A classic one these days is vitamin D. A typical lab normal range is about 30 to 100 nanograms per deciliter. There's a lab I'm familiar with that says their normal range is 25 to 85. And I personally think that an optimal level has to be greater than 60. So if you're in the lower range of those two, I would think that that is actually evidence of vitamin D deficiency, but you might have a normal test result. And then there are some individuals that I think are probably good experts that might argue, for example, that a normal or optimal vitamin D level is actually 100 to 140, completely above the normal range of most lab tests. So that's just an example of different authorities in different places with different philosophies stating, we don't think this is right, here's what's right, there's what's right. And so we don't have always consensus about this. So there's not just a monolithic agreement in science about anything. Everything is up for discussion and review and modification, and that's the way lab tests work. So we need to interpret them always in the lens of what symptoms does someone have, what have lab tests looked like in the past, has there been a change, and overall understanding of the physiology of the thing that we're looking at. So it's not just an easy thing of looking at a normal range and saying, oh, that's high, that's a problem, that's normal, that's no problem. You have to interpret this a little bit with a little bit more knowledge and experience. That's the reason that healthcare professionals can be very helpful, simply because we have spent a lot of time learning that stuff. So hopefully this has been a helpful overview of just the basic understanding of lab test results, so that you don't panic when you see something that's abnormal or feel totally comfortable when you see something that's normal. You have to be in conversation with somebody that knows what they're talking about, or you yourself need to be familiar with what really this means so that you can interpret your results properly.